Oncology Society, Dr. Humaid.
Looks like I cannot see my screen, so I have to look like this and talk at the same time. But it will work out, inshallah. So, over the next 10 minutes, I'll highlight to you our experience and our journey with the Emirates Oncology Society. And it's not a one-man show, it's actually a team. And I would like to encourage, or actually I would like to greet my colleagues here, Dr. Aida, Dr. Saeed, and also Dr. Prof.Humaid, and Dr. Al-Shamsi is here for their contribution. So the Emirates Oncology Society started back in 2016. And unfortunately, at that time, between 2016 to 18, there were no publications, no work has been done, no collaboration, no cancer awareness. As we know, cancer is a word nobody wants to talk about, and it's a fact, and it's okay. But the reality is, every one of us knows someone has cancer, either a family member, or a friend, or a relative. So what we did was, we decided to come as a group, and we started, coming up with an idea. How can we change the landscape of cancer in the UAE? And the only way to do that is by thinking first about our logo. This was the old logo. We believe that, we need a new brand, and the new brand has to represent our vision and mission. So the EUS, the logo clearly carries the UAE colors, and has the famous ribbon for cancer, and also it has the innovation, education, and research. These are actually our prime mission to increase about these topics in the field of oncology. So this is the logo as we started, and we want to build our brand. We established our website, we created a LinkedIn page, and trust me, it is very important to make people aware of your work, and create different platforms for social media, and then we started. Also create our own group, the Emirates Oncology group. This is only exclusive for the oncologists in the country, and nobody can be part of this unless he is a licensed oncologist in the UAE. Also, we had an EUS group that's for global, where we have colleagues from across the region, from MENA region, from Europe, and also from North America joining us. And also, we started to become part of the topics that the trends. We have national days for our friends and from other countries. Also, we had important events. So we participated actively in all these activities. So in numbers, we have 5 board members, we have 50 active members. Again, the oncology group is very small in the country, but certainly it's growing. We had more than 300 accredited CEs over the last few years, and also we had 60 plus publications over the last few years, and also we have 1 book publication, which I'm going to highlight in the next few slides. Let's talk about education. Education, so our mission was to bring the UAE name and the Emirates Oncology Society name at the global level. So we started with the collaboration, and again, this is very important regarding this event today, trying to bring the UAE name, Dubai name, Abu Dhabi name to the global level. So we had official European Society of Medical Oncology for the first time in UAE, which is a very big organization in cancer care. We had also ASCO, the American Society of Clinical Oncology, again, a huge name in the world of cancer. We brought these events and activities to the UAE for the first time. Also, we had the World Cancer Month, again, this is another big name in cancer care to the UAE, and also we've done more than 60 plus webinars and also hybrid conferences. In numbers, this is just to highlight, the activities and the numbers and the different things that we've done, including the best of ESMO and also the best of ESMO Gulf. So some of these activities are actually done for the first time in the Gulf region as well, and the breast cancer, which we're going to have again very soon. Again, this is the World Cancer, and also the immuno-oncology to be done for the first time in the GCC region as well. Also, we've done a special consensus for how to manage some of the cancers as a group, so we can treat our patient in a proper way and unified way across the UAE. Also, for the first time, we brought the concept of palliative care to be a very important part as well of the cancer care, and we are very proud to launch our first palliative care working group this coming on the 8th of October actually. Also, we are focusing on very important topics, growing topics, early onset cancer, including colon cancer. Many people, they don't understand how impactful it is, but in UAE, actually around 40% of patients, they experience colon cancer under the age of 50. I'm talking about all the patients with colon cancer. 40% are young, which is different than what we see in the Western countries. We also did a series of webinars to everyone, not only oncologists, to trying to teach the physician, practicing physician, how to conduct research. If you have a knowledge, you have to share it with your colleagues, and also it's actually very important to pass this knowledge and transfer your knowledge to medical students, to the residents, to the fellows, and we had more than 500 attended these webinars over 6 weeks. Public awareness, very critical. I will not say much about it, but actually we did a lot of activities when it comes to the public awareness over the last few years, and the Emirates Oncology Society became actually a very important need in the field of awareness of cancer. Our annual conference, the oncology conference, actually became one of the largest conferences in the country. We just had our third version September 1st, and we had attendance from different parts of the world, and this is something we're very proud of. Making your activities, public and everybody hears about it is very critical for the success of any society. If you have a conference, make it out there, let people know what's the outcome of the conference, what are the recommendations, and certainly this is something we're doing in an ongoing basis. Your PR shouldn't be done only once a year, it should be ongoing message throughout the year so people can hear and get the message that you have. We had multiple campaigns when it comes to the cancer awareness, and in fact we had very successful campaigns. Actually nothing satisfying more than seeing a patient come into your clinic and you say, "Doctor, I've seen one of your videos or one of the Emirates Oncology Society videos." In fact, last week a patient he saw a video about prostate cancer, and he said, "You know what, let's do a prostate cancer." His PSA came high, we did the biopsy, came back positive. So this is really satisfying to see that you're saving life. You're not doing this just for the sake of publicity or getting some attention. No, this is the message very important when it comes to the awareness about cancer. We had the World Cancer Day back in February, and actually we had very important event where we have achieved the largest number of frequents within 1 hour, and we achieved the Guinness World Record for this. And also we had the largest record done as well for the neuroendocrine tumor, which is a rare form of cancers. And this is the first time actually for society to receive 2 Guinness World Records. And again, this is not only for the achievement itself, but also because the publicity comes with increasing the awareness about these cancers. We also did a very special event 2 years ago where we put the logo of cancer awareness on Burj Khalifa, not once, but in fact 3 times. And this actually was done in the middle of the pandemic when patients were afraid to go to the hospital to seek medical treatment. Unfortunately, and my colleagues knows here very well that we lost many patients because they were afraid, they're delaying their treatment, and many of them actually they died. So we're trying to increase the awareness of, listen, if you have symptoms, if you have cancer, you have to come and see us. You cannot just wait until the COVID is over, because again, we are still doing COVID, and the reality is cancer doesn't wait. This is another event that we had also last year. Also, we had lung cancer awareness with the drones, with the Emirates Thoracic Society, with Dr. Al-Shamsi. This was in last year, in November. Again, a very important event to increase the awareness about lung cancer. We are seeing more and more patients, or actually younger patients, who smokes, vaping, shisha, and we're seeing more cancer in them, so it's very important to increase the awareness. Also projected the Emirates Oncology Society logo in Dubai Eye after they opened by a few weeks to increase the awareness about colon cancer. This was done in March this year. So what about research? The research actually is something very important. It's good that you see patients, it's good you take care of them, but the reality is if you want to move forward with the field of cancer, or any field actually, you have to do research. We published more than 60 plus publications over the last 3 years. And in fact, one of the first publications was as a group was what are the challenges of cancer care in UAE? As you can see, more than 50 authors from the group actually we published together. And we did not only publish, but actually we acted in these publication and recommendation, and actually we did make some differences when it comes to the cancer care in UAE based on this publication. This is another consensus how to take care of the cancer patient during the COVID-19, and this was one of the first actually publication when it comes to a group publication from the oncology group. We did publish in Lancet, we published in the JAMA Oncology, not once, but twice. We published in the Oncologist. Again, these are very prestigious journals, and certainly many times, we received excellent citation numbers for this publication. One of our publications actually reached more than 600 citations. This publication actually was the first study about cancer during the COVID-19 and the need for COVID-19 testing. It was done here in Dubai, and it was published in the JAMA. Again, it was one of the most trending articles at the time of publication, and it also was one of the most viewed articles at the time of publication. And again, this gives you the value of the research that, even though sometimes we have challenges, we didn't have enough funds, if you have a good idea or you have a good concept, it can click and can happen. Also, our research was actually highlighted in ASCO. ASCO is the American Society of Clinical Oncology, and this is a very prestigious website. Our work was highlighted multiple times, as I'm going to show you. Our paper actually still until now, it's number one in this work, in this search engine actually for publication. And again, this shows how the impactful our research can be at the global level as well, not only at the regional level. One of our publication also was named the publication of the year by one of the journals, which is the Oncologist, coming from Harvard University in USA. Also, one of our publication was one of the most cited articles from MD Anderson, and Dr. Aida knows very well what does that mean. It's very tough actually to get publication into any competitive list MD Anderson, but reaching number 8, this is this is really outstanding again for the entire group that we have. Again, our research was highlighted again in ASCO when it comes to other publications. We had 4 actually highlights, different time frames from ASCO, and this is something we are very proud of. So the Emirates Oncology Society was the most publishing society among all the EMA societies back in 2020. I don't know about 2021, but this was announced in one of the meetings. When it comes to innovations, let's talk about how can we make a difference at the global level and also at the MENA region. So myself and my colleague Dr. Aida and other colleagues as well, we decided to write a book about cancer care in the MENA region and the Arab region. Why? Because simply there was nothing. There was no data, and we decided to write this book. This book actually took exactly 5 years. We had so many challenges, but at the end, the book today, after 6 months from publication, holds almost 200,000 downloads, and we published this book for free. And the value of the book downloads actually almost 28 million dirham, because each book actually is around 150 dirhams. But we decided to make it for free because we wanted to share the knowledge with our colleagues and friends from across the region. And the book actually is available for free. If you Google cancer care in the Arab world, you can download for free from Springer. Again, why we do this? Because we want to make a difference in the care of our patients. 200,000 physicians, scientists, researchers, medical students, trainees, they will benefit from this, and hopefully to make a difference, inshallah. And we're preparing right now, hopefully, for second edition, so Dr. Aida get ready for more publications, inshallah. Again, the book actually was highlighted in ASCO, and I keep saying this because really, to get an article published about your work in a world-leading organization, it's very, very satisfying to see. And our book actually was named one of the most downloaded book in the Middle East when it comes to the medical book by the publisher, and this is something we're very proud of as well. We also want the authorities, the sheikhs, the public knows about our efforts, and it's very important because we need to align our efforts with the government effort to fight cancer. So we do, present our book in different, occasions to the sheikhs to bring the attention. Why is it important to fight cancer? Because cancer will continue to increase over the next 20 or 30 years, unfortunately. Innovation as well. There were no awards for cancer care physicians, researchers in the region, so we decided, you know what, we will be the one who are giving the awards. So we did this awards for the UAE, for the GCC, for the MENA region, and we awarded actually different people like Amira Princess Rida from Jordan, who's a big advocate for cancer care, and also Dr. Tony Schwell. If you know Dr. Tony, actually is a big name in cancer care from Harvard University. So we started to give these awards and also to other organizations in the UAE, for example, Abu Dhabi Public Health Center, for their efforts for increasing the awareness and also for programs to fight cancer as well, and also for prominent figures like Dr. Ramosa for their support for the organization and also for the Emirates Oncology Society. So other innovations as well, because we have so many conferences, we would like to protect the environment, so we're trying to reduce the using of plastics. So we are part of Dubai Can's initiative where we don't use any plastics in our events as well. Expo 2020, we had 8 different meetings at Expo. Unfortunately, I won't have time to show you, but we had very successful events. And again, this is part from our mission, trying to increase the awareness about cancer in the UAE and the region. So what's next? So to bring the mega international conferences to the UAE, and definitely that we need to work with our colleagues and friends from different organizations, trying to bring these conferences again. It's not about bringing just a conference, but this will bring more weight to our country, to our organizations, and definitely will help us to network with other organizations and to improve the care of whatever specialty you have, including the cancer care in the UAE. We do have the plan to open a breast cancer working group under the leadership of Dr. Aida Al-Awadi, palliative care working group, which is happening next week, and also cancer research and clinical trials working group, which is something we are very committed to happen, inshallah, over the next few months. What's happening as well, coming soon, we have the Cancer Care UAE book. This is our second book. It's going to happen, inshallah, in first quarter of 2023. And it's not easy to have a book published, but certainly we do feel that this is our commitment for our country and the region as well, trying to get the latest data available so we can work on this data and to improve the cancer care in the UAE. Our other book actually also, hopefully in the first quarter in 2023, is Healthcare in the UAE. And I'm very proud of this book because this book will highlight to you how can we as organized society, different societies under the umbrella of the EMA, we can work together. You can see internal medicine, the colon and rectal society, radiology, emergency urology, and hematology, and infectious disease. Everyone is contributing to by a chapter, and actually we do have more than 55 chapters, actually almost 60 chapters that covers the entire healthcare in UAE, and hopefully this will be also a reference. Again, this is a free access. We will not be charging any single fils or dirham for these activities. We are also very excited after a long journey from our efforts trying to increase the awareness about cancer. We are officially now part of the UAE National Committee to reduce, to combat or to control cancer, which is going to happen next week. Our commitment actually to trying to push for agenda to improve the cancer care, improving the uptake of the cancer screening, and also to have some implementation for other initiatives to improve the cancer care in the UAE. We have more than 20 active research publications happening now. Oncologists from the UAE, GCC, MENA region, fellows, residents, and medical students, everybody is welcome. We work as a group, and we hope by this to improve the cancer care in the UAE. And we are also doing more activities trying to increase the awareness of the public. Actually, this is a project I'm doing with my 3 kids in the high school. This is their summer project, trying to increase the awareness or to check how people are reacting to the world of cancer. And we have more than 2,200 respondents, and we're working to publish this, inshallah, over the next few months. And the only problem is my kids are fighting who's going to be the first author. So we'll figure this out later. The second thing is actually trying to engage the public about cancer, trying to increase their awareness, and hopefully this will change, inshallah. And by this, I would like to conclude my presentation and start the presentation.
Well, well deserved. I mean, if you look at Humaid, how young he is, mashallah. The things he is presenting, mashallah, like 1 century actually. So we bring the small.
This is actually the Guinness World Record certificate for the Emirates Medical Association.
Great, thank you very much, Prof. Humaid. That was outstanding, actually.